It's a real pleasure to be here. It's the first time I've been to one of the Defeat Duchenne meetings, either as Defeat Duchenne or as Jesse's Journey previously. But we're very aware of the work that this organization has done over the years and continues to do, and we try to be as absolutely supportive as we can. So we're here today because we have been working on the development of a novel medicine to treat this disease. My colleague, Dr. Michael Rudnicki at the University of Ottawa Research Institute, or the Ottawa Hospital Research Institute more correctly, and a professor of medicine at University of Ottawa, has made some really profound discoveries into this disease and into how to strengthen muscle in Duchenne. And the two of us have known each other for 20 years or more. We've been heavily involved together in the stem cell field, and we just felt that we needed to create a company to try to take those discoveries into commercial reality and develop a medicine that could benefit children. So my colleague, Dr. Ryan Mitchell, who heads our scientific and medical affairs, is going to tell you about what we have discovered, what we have invented, and when we will be in clinical trials. And it's very important to Michael and me as founders of the company that we provide the opportunity, but also receive the opportunity to have Canadian children in our clinical trial, which will take place starting in 2025. So this has been something that the two of us in particular have been working on literally for 10 years. So Michael's discoveries were made 10 years ago, and for 10 years we have been working on this. Our wives hope we get on with it and make this successful so they can see some more of us. But we're happy to be here. We hope this is a regular involvement for us going forward. And my colleague, you're in good hands with him. I'll come back on later to introduce my friend, Elijah Stacy. So I'll be back again.
Thank you, Frank, and thank you, everybody. So I've been able to do a couple of these online. This is also my first time in person, so it's been wonderful so far, and thank you very much for the opportunity. So as Frank mentioned, I'm going to tell you a little bit about what Satellos has been doing and what we hope to do in the future. Before we get started, I, of course, have to flash this disclaimer slide. I'm clearly an employee of Satellos. Satellos is a publicly traded company, and I may make forward-looking statements. So when this company started with Frank and Michael, it started with a question. What would a truly transformational medicine for Duchenne look like? And there were a number of criteria that came into that answer. A truly transformational medicine should be safe, but it should also be highly tolerable. It should be easy to administer. Life as an individual with Duchenne is complicated enough. We don't need our medications to be even further complicated. This kind of a treatment should not be limited by your mutation. It should not be limited by your ambulatory status. It should most certainly prevent any further muscle loss beyond what you've already experienced. And perhaps most excitingly, should it have the potential to bring muscle back? So I'm very excited to tell you that this is the potential for SAT-3247. We know from our preclinical work that our predicted efficacious dose is much, much lower than the mild tox profile we're seeing in animals. We've developed this drug as a small tablet, and we also will be developing it as a liquid formulation. We in no way predict that this drug will be limited by your mutation. We also do not believe that this will be limited by your ambulatory status. And 3247 has been designed to enhance the repair of muscle damage as it happens, hopefully preventing further muscle loss. And again, very excitingly, 3247 has been designed to facilitate the regeneration of muscle, providing the potential to physically bring muscle back. Now, why is it we think this way? I have to say that we can't take all the credit for ourselves, but A lot of this information comes from our founder, Dr. Michael Rudnicki. So Michael has been studying how healthy muscle regenerates in response to damage on a day-to-day basis for most of us. However, in looking at diseases of skeletal muscle, especially Duchenne, Michael noticed that Duchenne muscle doesn't just weaken, and you all know this in the room, it disappears. This disease is childhood onset that progresses over years, but you know that dystrophin is missing from day one. So how is it that a disease where you're missing the disease gene from day one is childhood onset and not immediately onset if it's all linked back to a shock absorber role of dystrophin? Muscle without dystrophin is, in fact, functional to a great degree prior to diagnosis, as well as in the early years post-diagnosis, but we know that that function is progressively lost over time. Now, it's not lost in the time scale of days or weeks, maybe months, but more so years. So again, this role of dystrophin not being in the fiber, creating muscle fragility, cannot explain why this is a slow process. So dystrophin must have another job. And that's exactly what Dr. Rudnicki discovered. It does. And that job has nothing to do with a shock absorber, but instead is as a signaling protein inside of muscle stem cells. So what is this signaling job and what does it do in muscle stem cells? So when dystrophin is present, it effectively helps muscle stem cells respond to injury. And it helps them respond by making new muscle tissue. It does that in a very special way by dividing to create what we call progenitor cells, and then these progenitors go on to repair all of that damage. And when dystrophin is there, that process goes forward smoothly. In Duchenne, when dystrophin is now absent in the stem cell, as it is absent in the fiber, that signal is missing, and this process is greatly impaired. It's not absent, but it is impaired. And so we have an ineffective regeneration system trying to respond to a constant insult of injury in Duchenne muscle owed to the lack of dystrophin missing in the myofiber. So what Satellos has done is designed 3247 to replace that missing signal in the stem cell. 3247 corrects this process and allows regeneration to go forward as it should in order to respond to the demands of the tissue damage we see in Duchenne. And it does this by inhibiting a protein called AAK1. When I'll save you all of the science and I'll translate it for you, it replaces that signal and it allows the stem cell to behave normally. Now, diagrams are nice, but let's get into some data. So I'm trying not to go too deep here, but what we're trying to summarize is some recent data that we have put out in a highly translatable model. This is the canine model of Duchenne. And do I have a pointer here? Maybe not. Okay, we'll start over here. So here we have a slide of what we're calling DMD natural history. So this is skeletal muscle from a Duchenne canine, roughly between 8 and 9 months of age. And what we're pointing out in these little squares are some muscle fibers, and I'm sure you've seen images like this before that have red staining inside. Today, that stain is for IgG. IgG is an immune signaling molecule that cannot enter muscle fibers unless they've been ripped or torn open and damaged. These fibers are now signaling for the immune system to come and clean up this damage. Unfortunately, this muscle will also not appropriately repair itself. This image next to it is a piece of biopsy out of the dogs that we treated prior to them receiving drug, just to show you that the dogs we treated had similar damaged muscle to a typical Duchenne canine of this age. The slide beside it is our dogs after 4 months of treatment with 3247. So these were roughly 9-month old dogs taken through to just over 12 months. And hopefully what you can appreciate is that picture looks very different, and it looks a lot like the picture on the end of the slide. And that picture on the end of the slide, of course, is a healthy animal. So from a histology perspective, allowing the muscle to repair and regenerate in a much more normal fashion certainly restores the architecture of the muscle tissue. So it looks better, but does it function better? So I have 2 graphs I'm going to bring you through, and I apologize if they're a little bit complicated. The Satellos data are in these nice teal and purple lines. The other 2 lines are literature reports of this canine model's natural history. So what we see in the gray line and what we're really mapping here is strength over time. So we're looking from roughly 3 months of age, just out past a year. The gray line shows you a healthy dog without Duchenne. And then we see this large decrease in strength in the Duchenne canine model. Here we see the first time point for our SAT3247 dogs. This is pre-treatment. These dogs were even weaker on this strength profile than the control Duchenne dogs. And then the next series of dots are 2 months and 4 months after treatment. So hopefully you can appreciate from this slide that 4 months of 3247 in these animals brought their strength profile back to that essentially of normal, healthy dogs. Now, another question we get asked a lot because of the current landscape is, how does a treatment like this compare to microdystrophin? So here again, looks a little bit different because we had to mold to what was published, but we've plotted our teal and purple lines against literature data of an optimized, recently published canine microdystrophin. So this is sort of the best shot you've got in the canine dog model. And again, we're plotting strength over time, except here we're doing post-treatment on the bottom. So hopefully what you can appreciate again, this black line that's flat, that's a control dog that received no treatment. This gray line that starts to increase, that's our microdystrophin. And then we have the Satellos treatment profile. So here we conclude that we compare favorably to sort of the best case scenario of microdystrophin in this dog model. What's also interesting to us about the power of this treatment approach is that our dogs were roughly 3 times as old as the dogs used in the microdystrophin study, suggesting that we should have a larger window for treatment with a therapy like this. So where are we now? I am most excited to tell you that we have officially started clinical development. So we dosed our first patient subjects earlier this week in a healthy volunteer study in Australia. We hope to have that trial fully enrolled by the end of the year, data readout sometime in the first quarter of next year. That healthy volunteer trial also has an arm of adult Duchenne patients where we are going to confirm PK. We want to make sure that the molecule gets into the bloodstream in the same way in a Duchenne background as healthy volunteers. And we are also going to be looking at safety prior to starting and enrolling our pediatric trial around the midpoint of 2025. And so internally, we have a large tox program running so that we can support these studies and continue to extend them as we go forward. That pediatric study will be looking at biomarkers, safety, as well as early indications of having an impact on strength. I would encourage you to speak to Defeat Duchenne to stay on top of this work and the progress of our trials, but you can always go to satellos.com